All right, we're demonstrating hip mobilizations to the right hip. I'm going to take you through a different progression here. First, I want to talk about the 4 grades real quick. Grades 1 through 4. We're typically going to use grades 1 and 2 for pain purposes, and then grades 3 and 4 getting into the tissue resistance to increase range of motion. Grades 1 and grade 4 are high frequency, low amplitude mobilizations. Grades 2 and 3 are low frequency, high amplitude mobilizations. So for these purposes, I'm going to show you grade 4. We're going to get into tissue resistance and we're going to provide oscillations to increase range of motion. So the first one we're going to do here is a cobble glide, meaning we are just going to apply traction at the joint. So his right hip, the plane of surface is in this direction. So essentially what I'm going to do is bring his leg up into, actually I'm going to do this leg so you can see it better. Never mind, that's weird. So I'm going to bring his knee up into flexion as far as it'll go. I'm going to bring my hand down at as close to the joint line as I can get without getting too close to his private area. And then essentially what I'm going to do is I'm just going to lean back and put all my pressure in that plane of the hip. So I'm just pulling down and away. And you can feel when that tissue it starts to get some resistance that I'm in that grade 4 region. And this is where I'll apply the oscillations at. The next progression we're going to do is an anterior to posterior mobilization. So I'm going to bring his right leg up and over and cross here. And we're trying to increase the extensibility of the posterior joint capsule. So essentially what I'm going to do here, which will increase flexion and internal rotation. So I'm going to use my chest and pretty much my whole body. I'm going to cup at the knee here, and I'm going to go down with the plane of the femur straight toward the posterior joint capsule, like this. I'll ask my patient where they feel it. Hopefully in the posterior. If it's in the anterior region, I'll adjust a little bit. Okay, and again, I'm going to go all the way into tissue resistance and apply that pressure and apply an oscillation there. The last one we're going to do is an army crawl. So I'll have my patient on his stomach, and he's going to bring his right knee up. We're going to go as far up as we can here. We might start in a lower degree of hip flexion and then gradually progress up into further hip flexion. So that you can see it, essentially what I'm going to do is take my hand and kind of crest it right underneath his butt cheek like this, so I can get as close to the joint line as possible. I found it almost even more effective to use essentially what you would use for a hand grip with CPR. I take my right hand and put it under the crest like this, and then overlap with my left here. And essentially what I'm going to do, so you can see it, I'm going to approach from here. We're going in an anterior direction here. So the hips, the joints line like this, so we're going to apply our force here. So I'll come here, okay, and essentially what I'm going to do is apply it straight forward. I'm putting all my weight in this. All the way through to grade 4. Again, this is going to increase extension and external rotation based on arthrokinematic principles. And we're trying to increase range of motion and decrease pain.